Hello, everyone, and thank you for joining us today. My name is Tiara Brooks from School-Based Health Alliance, and we would like to thank you for attending today's webinar titled Children's Health and Education Mapping Tool 101 Training. The objective for this webinar is to introduce the mapping tool to users and provide basic understanding of the tool's core functions. But before we get started, we have a few housekeeping reminders before we get started today. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. Attendees will be asked to complete evaluation poll questions at the end of this webinar. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archive webinars for topics such as the ones you are viewing on your screen. Now I would like to introduce our presenter today, Ms. Erin Scheller. Erin is the Research and Evaluation Manager at the School-Based Health Alliance. Erin earned her Master's of Public Health degree from the Johns Hopkins Bloomberg School of Public Health, focusing on professional epidemiology, program planning, and evaluation. She has an undergraduate degree in anthropology from Washington University in St. Louis. Erin has a background in maternal and child and reproductive health, including work with Child Trends, the San Francisco Department of Public Health, and the United States Agency for International Development. As a nurse trained at the University of Pennsylvania, she has on-the-ground experience for a variety of patient populations domestically and internationally. I would now like to welcome our presenter today, Erin Scheller.
Good afternoon, everyone. Thank you for the introduction, Tiara. Welcome to this new training on the Children's Health and Education Mapping Tool. I'm very excited today to continue sharing our Children's Health and Education Mapping Tool on behalf of our team, including Haley Lofink-Love and Samira Solomon-Poor from the Alliance, as well as our partners at Health Landscape. The Children's Health and Education Mapping Tool was released in conjunction with the 2013-14 Census Report on January 7th and allows users to interact with their census data in a whole new way. This afternoon, I'll give a brief overview of the tool and some background from its development, our goals for how the tool can be useful for the field and others interested in advancing children's health and education, as well as a demonstration and introductory level training. So we will be sure to save lots of time for all of your questions at the end. The Children's Health and Education Mapping Tool builds on the power of Geographic Information Systems Technology, or GIS, for data-driven decision-making for those who are interested in chronic inequities among low-income children and the social determinants of health. Indicators of children's health, education, and socioeconomic status at the county level can be searched, mapped, downloaded, and compared to national averages. Public school, school-based health centers, or SBHCs, and other health facility locations can be mapped and filtered and key characteristics displayed. The tool can be used to assess community child and adolescent health, identify areas of need and target new services, examine characteristics, collaborate with and learn from local peers, raise awareness to policymakers, and fundraise with effective data and visuals. The tool is free and available to a wide range of audiences. We would love to hear about your ideas for how you might use the tool in your work and encourage you to stay in touch with us at research@sbhforall.org via the forms on our web pages. So we hope to ask at the end of the webinar. I know many of you shared some of your early ideas for how you might use the tool, and we'd love to hear your feedback during the Q&A time as well. The goal for the tool is to support stakeholders across different sectors who want to address inequities in children's health, education, and well-being. The vision all along has been to bring together a variety of data on child and adolescent health that's normally in distinct silos, including specific information on SBHCs. We want to make information about the wide variety of social and other determinants of health readily available to help think upstream about interventions and policies, so the tool uses a social determinants of health lens. Addressing social determinants of health is something that the school-based healthcare field has been doing for decades. The mapping tool brings this lens to bear by including data on upstream issues affecting health, like violent crime rates, housing, and education. Some of you might be aware that the seeds for this tool were planted long ago, and we decided to partner with Health Landscape to make this software available widely. They created and run the UDS mapper, which some of you might also be familiar with. We also want to gratefully acknowledge all of the funders of the tool, including Aetna, the Bureau of Primary Health Care, Atlantic Philanthropies, and the Bechtel Foundation. This summer, we engaged many participants in a pilot to strengthen the tool and our training information, and we look forward to your continued feedback. The tool was launched just recently, and we've had some early adopters providing their case studies of how they've been using the tool. And we're excited about the potential of this tool as we embark on some goals with the Alliance to help grow and strengthen the school-based healthcare field. We've been framing the tool as having 7 key functions that are related to public health. I'll introduce them here, as well as some of the data in the tool, and use the key functions to guide some examples as we walk through the live tool. The first function we thought about is assessment. A user can use the tool to see how their community might compare to other counties in their area on health outcomes, such as access to care, including demographics, education, and socioeconomic status. Users can also use the tool to help identify areas with access to strong healthcare services, as well as identifying areas that might have shortages, including of potential services or professionals. Users can also use the tool for planning. After high-need areas have been identified and assessed, you can use the tool to target some of those areas with expanded or strengthened health and social services. The tool can also be used to examine the characteristics of public schools and school-based health center locations. Users are able to see some specific characteristics like school population sizes, the grade levels served, staffing profiles of school-based health centers, and their hours of operation. The tool can also be used for collaboration. Users can identify local organizations with whom they might coordinate care or develop relationships to find out what's working in other communities and how they can bring that into their organization. The tool can also be used to raise awareness. Users are able to print or share the maps that they've created throughout the process and take them to key stakeholders. Lastly, the tool can also be used for fundraising. Because the tool brings together data from a variety of different sectors and different resources, the tool can create maps that will be useful in grant applications or reports to funders. Next, I'll touch briefly on some of the data sources and the limitations. We used data from a variety of different sources for the tool, including U.S. government data, such as from the Census Bureau, the Centers for Disease Control and Prevention, HRSA, as well as the School-Based Health Alliance's census of school-based health centers. We included our most recent census data from the 2013-14 school year, And we also include some education data. A variety of different data are found in the tool. We have information on health insurance and coverage, including percent of children under 18 who are on Medicaid or CHIP and who are uninsured. Health indicators include the teen birth rate, percent of obese adults, food insecurity in the total population, the chlamydia rate. We have information on education, including the percent of adults with no high school diploma. Demographic and socioeconomic data include percent of students eligible for free or reduced lunch, the percent of kids in poverty, those living in single-parent households, households with severe housing problems, and the violent crime rate. All of the indicators that I just mentioned are available at the county level. Public school data includes location of all public schools, as well as whether they are eligible for Title I funding, whether they serve different grade levels, their total enrollment size, and free or reduced lunch eligibility of their students. SBHC data come from our most recent census and include the location of all school-based health centers, as well as sponsor types, staffing models, hours of operation and population served, and grade level served. We also include information on healthcare facilities and shortage areas, including the location of U.S. hospitals, federally qualified health centers and lookalikes, the location of rural health clinics and SAMHSA treatment centers, as well as health professional shortage areas and medically underserved areas. I want to touch briefly on some of the data limitations of the mapping tool. County-level data is the most discrete geography with data in the tool, but there is an option to upload your own more local data. For instance, if you want to look at poverty rates by dicta within your county, you can upload those data points. Our website and the resources section of the tool describes each of the data sources in more detail. The data come from different sources, so there may be specific counties that are missing data for some indicators, and the years are not the same across all the different data points. The tool looks at data at a point in time and is not longitudinal, so cannot help explain why there may be a county that is underperforming on a certain indicator. Lastly, the tool does not have the ability to capture or test for statistically significant differences between counties or states and indicator values. So now I am going to jump into a quick demonstration and example of the live tool, and feel free to jump in with any questions. And while I switch to the live tool, Tiara has a couple of brief poll questions for you.
Okay, everyone, to get started with our first poll question, have you ever used GIS? Please take a few moments to answer the question. Okay, thank you, everyone. 71% of you said no, so hopefully you will learn quite a bit from the training today with Erin, and 29% said yes. Okay, our next question is, has anyone used the Children's Health Education Mapping Tool? Please take a few moments to answer the question.
Great. Well, it looks like we have many people who are new to GIS and to the Children's Health and Education Mapping Tool, which is why many of you are here today. So we are happy to have you. I'm going to give a brief demonstration of the tool to get you acquainted with it, and then I'll dive deeper into some of the core functions that we've thought about with an example scenario. And one general note, the tool works best in recent versions of Mozilla Firefox. So keep that in mind when you go to actually use the tool. All right. So the Children's Health and Education Mapping Tool is located on our website under the Resources tab, and I'll share some of those with you later. When you first come to the tool, this pop-up window will appear. You don't have to see it every time if you don't want to, but since I'm just going to do a quick walkthrough, I'm going to select the entire United States. You can choose to focus on a particular state if you want. And over here on the left-hand side, we have the zoom in and out. So I'm just going to zoom out a little bit so that I can see the entire United States. And you're able to grab and move the screen around within the window if you want to. So I'm going to use a really simple example. We're aiming to grow the field of school-based health centers by 30%. So we think that this tool has the potential to identify counties that might be having some particular health or education issues that school-based health centers might help address. So we're going to look at where school-based health centers are now, as well as schools, and dive deeper into some of these counties. So there are three main layers to the Children's Health and Education Mapping Tool. The first is the Child Health and Education Indicators, which you can see is open here now. So that one opens automatically when you come to the tool. Again, here you can select the entire United States or any particular state, and then you can look at indicators on children's health, as well as education and socioeconomic status. I'm going to begin by selecting under 18% on Medicaid or CHIP. All of our indicators are set automatically to compare to the national average. So when I click on the checkbox next to under 18% on Medicaid or CHIP, counties will become highlighted in blue that are underperforming compared to the national average, meaning that these counties have more than about 36% of children who are on Medicaid or CHIP. I can click on this information button here next to each of the indicators to find out more about its definition, as well as the data source. As I mentioned, this ball here is automatically set to the national average, but you're able to move that comparison as you would like. So for example, if you wanted to instead look at a particular state and compare it to the state average, you could click on this ball and use either your mouse or the arrow keys on your keypad to move that indicator. I might want to also see if counties that are underperforming on Medicaid or CHIP are also counties that have a high percentage of kids who are living in poverty. So I can select a second indicator. When I select an additional indicator, I see that there becomes two shades of blue now on my map. And counties that are underperforming on both of the indicators that I've selected will become shaded in a darker shade of blue or gray. I can see here in the legend what indicators I've selected, as well as what my benchmark is set at. Here you can also see that we have all of the state outlined right now as well. This is the high needs area identifier. Here I'm able to hover over a bar and see how many counties are underperforming across all of the indicators that I've selected. So by hovering on this bar for 2, I see all of the counties across the United States that are underperforming, both for percent of kids in poverty and percent of kids who are on Medicaid or CHIP. The other thing that I can do in the Child Health and Education Indicators layer is hover over a particular county, and a pop-up will appear where I can see some additional information, including some demographics, what the total population is, and the number of public schools and school-based health centers in that county, as well as in the state. The second layer that we have after we've identified all of these high-need counties is the school-based health centers and school characteristics layer that allows you to map the locations of and filter and view key characteristics of public schools and school-based health centers. So when I click on this checkbox next to public schools, it will take a minute and it shows me that there are lots of public schools across the United States. So here I can see there's almost 100,000. I also see here that there's the option to filter based on some of these key characteristics. So for example, if I wanted to see only schools that are eligible for Title I funding, I could click on that and we can see that it has eliminated the schools that are not eligible for Title I funding. And when I'm going to get rid of this layer, I can just click again next to public schools and it will remove those. You can do the same thing with school-based health centers. We can see here there are fewer of them. And school-based health centers that do not provide us with any census data are shown in bronze, and those that do have data are shown in green. And that's because when we go over here to filter, if we don't have any data, we won't be able to look at them in more detail. But when I go to a particular school-based health center and click on it, I can see here that because there are a lot of SBHCs that are close together, I can just use these arrows up here to move through the different windows. But here I'm able to see some of the information about this school, including its address and some demographic information, as well as more specifics about this particular school-based health center, including its sponsor organization type, some of the hours of operation, the populations it serves. Next, I'm going to jump to the base maps and optional layers, which is the third main layer in our tool. Among other functions, it allows you to add the location of hospitals, FQHCs and lookalikes, and other healthcare facilities, as well as identifying medically underserved areas and health professional shortage areas. So here I also have, you'll see some control over the base map. So right now I have the states outlined, but if I wanted to get rid of that, I could click that checkbox next to the states. I could also change what the base map looks like, and here I can use a more common topographic layer. You can see then some of the details of some of the lakes and things like that more, but the default is this canvas with labels. You can also choose to add highways if you wanted to, and here you can see healthcare facilities. So if I wanted to see all of the hospitals in the United States, I could click that checkbox. You can see that there are a lot of those as well. And I'm going to go to my legend and just page over, and I can see that the blue hospitals are short-term hospitals, red are critical access, and the beige color is other types of hospitals. If I wanted to remove the hospitals, again, I will just click briefly on this checkbox here. You can also see that there's some information on health policy, including boundaries for the U.S. Congress. We can see that there's information here again about whether a county does or does not have a school-based health center. And I can also map health professional shortage areas. And again, in my legend, I can see that those are shown in the brighter teal color with hatching. And there are a fair number of areas across the United States that have a shortage of primary care providers. And I'll also just highlight that the other thing is that we have a resources tab in the mapping tool. And here you're able to find some links to our web pages and some other basic information. We also have a data tab, which will allow you to export data from the child health and education indicators layer. And it looks like we have a few questions, so I might just address those before walking through an example to demonstrate some of the other key functions. So we had a question about whether the data in the tool includes location of specialty providers, in particular looking at vision care. So currently the tool does not have information on those types of specialty care providers. One of our partners, OneSight, has been working on trying to map some types of vision clinics, and we'll be making a blueprint resource available on our website that will have some maps of that information. But one thing that I'll touch on in the example and share now is that the tool does have the ability to upload your own data. So under Tools, you can see that there's also this Community Health View, which includes many other publicly available data sets and information, and that will be the subject of some more advanced trainings in the future. There's also Map My Data Point and Map My Communities data. So for Map My Data Point, you could add address data. So for example, if you have a data set of optometrists, you could map those yourself and share that with some of your partners or folks that you think might be interested in that. And then you can also map My Communities data, which it allows people to upload aggregate data, so either at the zip code or the county or the state level, and include some additional data that way. We know that there's many potential indicators out there and data points that people would like to see, and so we're eager to continue to get your feedback on what you're interested in, and we'll keep track of that as we continue to make updates to the tool along the way. And we know that this tool really was developed nationally so that all of the states would have comparable data points, but we know that within a particular state or community, it's important when you're doing a needs assessment, for example, to have some more detailed local information. So we're excited about the potential to upload your own data that might be specific to an area but not available nationally. Okay, great. Sounds like there are no other quick questions right now. So I'm going to clear some of these other things off of the map. And again, if I click on the little circle, I can reset the data and it will let me start from scratch. So since many of you are new to using GIS, this exercise will provide a basic way to think geographically about some public health issues. And I want to note that this scenario is based on publicly available data, but it's only an example, and a comprehensive strategy to address any public health issue would require local understanding, perspectives, and additional data, and we appreciate Georgia being our pioneer example state for this training. So in this scenario, you are a Georgia State Department of Public Health program analyst interested in nutritional issues affecting children and adolescents, as well as other community members across Georgia. You're working collaboratively with representatives from the Department of Education to develop a comprehensive strategy to address healthy eating, since you know it influences learning and focus in the classroom. You recently learned about the School-Based Health Alliance's Children's Health and Education Mapping Tool and want to explore how it can be used as part of the process to tackle this public health issue. You've engaged a variety of stakeholders, including community organizations and researchers, to form a task force to think about creative and innovative solutions for high-need communities in your state. The first question that you and the local task force want to address is to gather information about nutritional issues across Georgia. Where are there high pockets of need and what data are available? So in the Child Health and Education Indicators layer, I know that there are a few different indicators that are related to nutritional issues. So I'll start by selecting obesity. And I know that this is set to my national average, which is 27%. So here I can see all of the counties that are underperforming compared with the national average for obesity. So meaning that these counties have 28% or more of adults who are obese. So I can see that there are a lot of high-need counties in Georgia on this indicator. I might want to look as well at food insecurity, because we know that sometimes these issues are associated or coexist, especially in low-income communities that might have limited access to nutritious foods or stressors from poverty. So now I'm going to select food insecurity, and I see that there are a fair number of counties that look like they might be underperforming on both of these indicators. If I come down to my high needs area identifier and click on that, I can select only the counties that are underperforming both for obesity and food insecurity. And maybe I want to find out more about a few of these counties. Again, I can hover over them to find out some more of the details, looking at counties that have different population sizes and a little bit different demographic information. But I am interested in particular in youth. So maybe I want to also see the percent of students in a county that are eligible for free lunch. So I can add that indicator on the map as well as percent kids in poverty. And now I see a more select group of counties that are highlighted. And if I click on that indicator, the bar for 4, I'll look only at the counties that are underperforming relative to the national average across all 4 of those. And maybe these are the counties that I might start by thinking about for selecting to zoom in on as I think about potential solutions. So I know that obesity and food insecurity can sometimes go along with other healthcare issues. So I'm also interested in seeing what areas across Georgia meet the criteria of being medically underserved areas and primary care health professional shortage areas. Maybe there are a lot of needs in this county that aren't being met across those particular issues as well. So I'll go to the base maps and optional layers and select medically underserved areas. And in my legend, I will zoom across to see medically underserved is represented by these purple boxes with dots in them. And I can see that a significant portion of Georgia is really qualifies as a medically underserved area, except perhaps for some of the area right around Atlanta. I can layer on top of that and also look at the HPSAs, or primary care provider shortage areas, and see that there are some of those, but a fewer number perhaps than medically underserved areas. And I can see that especially in southern and western Georgia, this seems to be a potential issue. So after conversations with experts and reviewing the Community Preventive Services Task Force recent recommendation that school-based health centers can help improve health outcomes and access to services, the local task force decides to establish and strengthen SBHCs in your state as one component of a comprehensive strategy to address nutritional issues affecting these high-need communities. Some SBHCs have a health educator or nutritionist as a member of staff, and SBHCs can help form partnerships to strengthen access to healthy foods. So you're interested in knowing where there are school-based health centers currently located in the state and whether or not they're in these high-need counties. So since I'm already in the base maps and optional layers, I can see here that there's an option to see which counties do have a school-based health center. And I can see that in Georgia, it looks like a fair number of those counties or of those areas that are high need do have a school-based health center. We can see about 4 counties down here and some more up by Atlanta. But I want to find out some more of the details about those school-based health centers. So I'll come back to my SBHCs and school characteristics layer and select school-based health centers. And I will decide that I want to see which ones have a staffing model that includes primary care and behavioral health, as well as potentially nutritionists. So I see that that's a more select number of SBHCs, and if I want to learn from some of them that might have a nutritionist on staff, I can click on it to zoom in farther and see what types of staff they have and some of their information so that I can reach out to them directly as a potential partner. To identify schools that I might want to establish a school-based health center in, I'll click on the public schools. And we know we're particularly interested in high need and underserved populations, so I'll look only at Title I, and I'll just click on that box. And if I also wanted to look at those schools where a significant portion of students are eligible for free or reduced lunch, I can click on this bar and either drag it with my mouse or page over with the arrow keys on my keyboard. And now I see a more limited number of potential schools. So one feature I can use is this draw feature. Here I can select outline only, and maybe I've identified these as particularly high need counties and schools that are Title I eligible. So there are schools that I might want to partner with. And if I want to make a note of that, I can select a rectangle, and I can just draw a rectangle around this area that I'm going to decide that I want to focus on. So now that I've assessed all of these aspects of child and adolescent health and looked at some demographic information, identified these high need areas, and examined the characteristics of public schools and school-based health centers in the area and planned for these new services, my team's ready to collaborate with other potential partners, raise awareness to policymakers, and fundraise for expanded school-based health centers. So now I want to know if there are any potential clinic partners in the area, so I can come back to my base maps and optional layers and see whether there are any health center program grantees, so federally qualified health centers or lookalikes in the area. And I see that there are a few different potential FQHCs in the area that I might want to partner with. I can find out the names of those clinics by zooming in farther to see the facility's name. But I also know that the task force has identified a potential funder, and for the proposal to them, I want to show that the highest need areas for food insecurity and obesity are being targeted in our strategy that includes school-based health centers and some other intervention components. So I can also look at a data table, and so I can go back to the child health and education indicators layer because that's where all of the data are that I am able to export from the tool. If I wanted to see all of the counties, I could just move one of these indicators to 0, and then when I come to my data tab, I'll see all of the different counties in Georgia as well as their information across all of the indicators that are available in this child health and education indicators layer. I can remove certain indicators if I don't want to see them anymore and make this table a little bit easier to read, and I'm also able to click here to export this table to a CSV or Excel type file. And I want to save time for questions at the end, so I will say that we can do an example of how to map my data point, and then we will open it up for questions. So if I wanted to partner with local food banks in some of these areas, because we know that sometimes they do partner with schools, and I want to find out what food banks are in my area, I can come to map my data point. And I've already put together this spreadsheet that's set up in the way that the tool requires it. So basically for Map My Data Point, you'll need a column titled Address with the address information, as well as the city, state, and zip code. Here I've also included the name of the food bank and whether or not they already have a partnership with local schools. I'm just going to go ahead and copy these data. And here I'll click and it says copy it, so I'll just press Control-V to copy those tables. And here you can see it asks what are my address columns. So again, these matched the way that I had my data already formatted. I had the address, the city, state, and zip code. Then here it asks me what the different columns are. So for title, we'll put the food bank name. For group or category, I want to be able to sort the data points that it puts on the map by whether or not they already have a partnership with a local school. This asks me if I want other information to show up in the rollover tooltip box, which were the yellow pop-ups that we saw previously for the counties as well as the school-based health centers and public schools. So I'll select that I want to see all of these. And then I will go to geocode now. And we can see there are only a few data points. So if I come down here, on the bottom right, I can see that the color scheme set up to quantitative, but my information is just yes and no. So I'm just going to say that I want it to be qualitative. And for the shape, we can see that you're able to select that. I'm going to make them a little bit bigger so that they're easy to see. And we only have yes, no that we're sorting on, but I'll just make it 3. So here I can see there's a number of different food banks that are shown in the green or in the purple. And we can see that those are also demonstrated in the legend. So it just says yes or no. I might want to make that a more detailed label in the future so it's easier to see just from the legend. But when I come and hover over one of these, I can see the detailed information, including the name of the food bank, whether or not it partners with the school, and here I can see that this particular food bank does not. So I know that my purple ones are food banks that do already have a relationship established with schools in the area. So that's one potential way that you might upload your data and add it to your map. So lastly, my task force really wants to get the support of some key stakeholders for these expanded school-based health centers and additional partnerships with local food banks. So I want to print and save my map. So I have 2 options. I can share my map, and if I click here, it will give me a URL that I can copy, and I can save that so that I can come back to my map later to make any changes or share that with my team. And I can also select to print this. So we recommend printing to PDF. And here you can see that you're able to move if you wanted to zoom in now. You could do that. You're able to zoom in and move the particular window. And you can also add a title here. So that will allow you to save a PDF of your map and share it with others. And I know that we have a number of questions coming in, and I'm excited to hear all of those. And I'll just add that you can come to our website as well to find some additional information, including more details about all of the data sources as well as the tool. We have some video tutorials, which is where this presentation will be saved in the future, as well as a user manual and some FAQs. So I'm excited to see what some of our questions are, so please go ahead and type any questions that you might have in the chat box now.
Well, thank you, Erin. Actually, you just answered one of our questions that we did have. This webinar is being recorded, and like Erin said, it will be uploaded to our website in 3 to 5 business days. But feel free to please go on the website if you want to just play around with the mapping tool and use some of the indicators that Erin has shown us today. We'd like to give everyone an opportunity right now to please answer your questions. We'll start answering some now.
Okay. So we had a question about how this tool differs from Community Commons, which is another GIS type tool that I'm somewhat familiar with, but might not have all of your particular, all the answers to that question. But I can say that one of the major differences is that this tool includes more information on child and adolescent health, including details on school-based health centers, which is not available in Community Commons. And I don't know whether or not Community Commons has the ability to locate all of the public schools and see some additional information about public schools as well. So Michelle had a question about using the share option and whether that will maintain the map as it currently is, or whether it would incorporate any changes that you might make in the future. That is a great question, and to be honest, I will have to follow up with our health landscape colleagues to get you a positive answer on that, but I think that it should stay the same. So if you save the map with that link and then want to make changes in the future, I would say that you should then share that new link potentially so that you can come back to that. But I will double check on that and follow up with you. And we'll add that to our FAQs page. And as you all think of other questions that you might have, I would also love to hear what your ideas are for how you or your organization might think about using the tool so that we can provide any technical assistance that you might need in the future.
And as we're waiting for many of you, if you want to enter more questions or if you have any comments, please feel free to enter in the question box also. We'd like to also offer this opportunity to let you know about our membership that we have here at School-Based Health Alliance. School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work, and we ask that you please join us. With becoming a member, there is two types of memberships that we have, individual and organizational. Our members receive exclusive access to valuable programs, tools, timely publications, and networking opportunities, news and resources, and special members-only weekly updates, discounts on professional services and products, and letters of support for grants. So we ask that you please go on our website and join us. If you have any other questions, please feel free to also email us at info@sbhforall. And there's also a link on there for additional information for membership.
And there is a question about TA, which we would definitely be happy to provide. You can contact me, but the best email address to reach any one of us with questions about the mapping tool is at research@sbhforall.org.
All right, we're actually going to do one more demonstration before we leave today.
Okay, so we have had a question in the past too about the. Sorry, I need to make sure that you all can see our screen. Okay, so now we're back to the mapping tool. So we have had questions in the past about this layer controls option. So this allows you to change what is shown on top. So here we can see that we added our newly mapped points last, but if I wanted to see all of the schools, instead I could drag those up. So for example, if I want to make sure that all of the FQHCs are most visible, I can do that. And if I want the FQHCs to appear not quite so dark, I can just use this slider and that will make them a little bit more transparent. So that's especially helpful for when looking at things like the medically underserved areas or the HIPSAs, because they do cover a lot of space, and that way you're able to kind of control how dark the different shading is. We'll give you just a couple more minutes for any last questions, but we would love to get your feedback on this webinar. So Tiara is going to go ahead and launch some poll questions.
Thank you, Erin. We do have a few poll questions. We would like to ensure that we are meeting all of the needs of our attendees here today. If you can please take a moment just to answer a few questions for us. And the first question we have is, did this presentation meet your needs? If you can just take a few seconds to answer yes or no. Thank you. Thank you, everyone. Our next question is, how well did the presentation meet the stated objectives? If you can please take a few seconds to answer the question. All right, our next question is, how likely are you to apply information from the presentation in your organization? If you can please take a few seconds. All right, and our final question is, would you recommend this webinar to others? If you can just take a few seconds.
Great. Thank you all for answering those poll questions for us. We greatly appreciate you joining us today. We encourage you to help us please spread the word about the tool and reach out to research@sbhforall.org with any TA questions as you begin using the tool. We also encourage you to check back to our website for future webinars, upcoming video blogs about the tool, and more. So thank you again.
Thank you, everyone. Have a wonderful day.